Hello everyone. Today we'll be looking at body fat, which many people are curious about. Body fat is energy stored in our bodies from nutrients we consume, but don't use for bodily functions. Body fat plays important roles in our body, helping to protect our organs and regulate body temperature. When needed, it can be broken down and used as energy again. However, excessive accumulation can lead to obesity. What is the normal range for body fat percentage? Body fat percentage refers to the ratio of body fat to total body weight. The normal range is about 14 to 20% for men and 18 to 28% for women. The reason for this difference between men and women is that bodies store fat differently. Men generally have more visceral fat while women have more subcutaneous fat. Why is body fat percentage important? Adult obesity is often caused by visceral fat, particularly abdominal fat. Abdominal obesity specifically is a cause of metabolic syndrome, including cardiovascular disease, diabetes, and hypertension, while subcutaneous fat is located far from the center of the body. Visceral fat is connected to thick blood vessels in the center of the body, making it more mobile. If you are overweight, it's advisable to manage your weight while regularly checking your body fat percentage, which is closely related to visceral fat. Normal body fat percentage ranges by age group. Teenagers, women during puberty, body fat tends to concentrate around the thighs and hips. The recommended body fat level during this period is in the range of 25 to 28%. Men, due to differences in hormones, muscle mass, and fat distribution, men have lower body fat percentages than women. This is because testosterone promotes muscle formation. The healthy body fat percentage range is between 12 to 15%. 20s and 30s, women. For healthy young women, body fat in the range of 21 to 32% of total body weight is appropriate. Men, a lower range of 8 to 19% is considered healthy. Testosterone levels peak in the mid-20s during this period. Middle age, women during middle age and menopause. Decreasing estrogen levels tend to cause fat to move from the hips to the abdomen. This leads to an increase in visceral fat. The healthy body fat percentage for women in this age group is between 23 to 33%. Men. For middle-aged men, the healthy range is between 11 to 21%. Men also tend to accumulate fat around the abdomen during this period. After age 60, elderly people tend to have a much lower muscle-to-weight ratio compared to younger people. Generally, metabolism slows down, making fat accumulation easier. But these changes can actually be beneficial to health. Fat serves as an energy source, so it can help elderly people overcome illness when they lack appetite. And it can also help prevent injuries from falls to some extent. Guidelines suggesting that elderly people should lose weight might actually be counterproductive. For women over 60, 23% to 36%. For men over 60, 15% to 25%.